Thank you for coming along to our industry briefing for psychosocial services commissioned by the PHN. Before we begin, I'd like to acknowledge the traditional custodians on whose land we meet on today and pay my respect to elders past, present and emerging. The purpose of today is to inform our stakeholders that the PHN will be commissioning the delivery of the National Psychosocial Support Measure, Continuity of Supports and the National Suicide Prevention Trial. The PHN has decided to group these three available funding streams under the one tender as their primary focus is to deliver psychosocial services. We will cover off on what that means for the community, as well as give an overview of the procurement approach and the tender process. Because of our PHN's large geographical region, these industry briefings are being conducted simultaneously in three locations. Therefore, in the interest of fairness and transparency, the PHN will be taking all questions on notice during today's briefings. This will allow all interested parties to receive the same information at the same time. All questions and answers from the industry briefing across our PHN region will be available on the PHN website. We will email those who have attended today when question and answers are available, but we anticipate this will be around Monday, the 10th of September. As I've just mentioned, the PHN has three funding streams to procure psychosocial services for: the National Psychosocial Support Service, Continuity of Supports, and the National Suicide Prevention Trial in the areas of North Burnett, Maryborough and Gympie. The PHN has listened to the needs of service providers and acknowledges that it is time-consuming to write multiple tender bids for various funding opportunities. Taking this into account, the PHN has decided that this tender will cover multiple funding streams that deliver similar services through the one tender process. We will explain that process a little later and outline what it means for service providers. Before we get into each funding stream, I'd like to clarify what funding is available. For the National Psychosocial Support Measure, $2.24 million is available over 3 years. In addition to this, each successful bidder that receives funding under National Psychosocial Support Measure will also receive a small establishment fee that may assist with communication or any other startup costs. The budget has been split across Central Queensland, Wide Bay and the Sunshine Coast based on population figures. However, the PHN will also be considering existing services and need and will allocate funding accordingly. The funding parameters for continuity of supports are still unclear at this stage, and we will outline this further in the presentation. For the National Suicide Prevention Trial, at this stage we are looking to identify those who may be interested as part of this tender process. I will now talk through each funding stream and outline the purpose and scope, starting with the National Psychosocial Support Measure, or NPS. In the 2017-18 budget, the federal government committed $80 million until 2021 for the National Psychosocial Support Measure. The purpose of the National Psychosocial Support Measure is to provide psychosocial support services to assist people with severe mental illness resulting in a reduction in psychosocial functional capacity. These people are likely to be ineligible for assistance through the National Disability Insurance Scheme, the NDIS. As part of the budget announcement, state and territory governments were asked to match the funding for the service to proceed. A bilateral agreement was signed between the Commonwealth and the Queensland Government, and the agreement outlined that the Queensland Government would undertake their own procurement process. The PHN will be commissioning just over $2 million until 2021 under the National Psychosocial Support Measure to support people in the Central Queensland, Wide Bay and Sunshine Coast PHN. We will be working closely with Queensland Health to ensure that services are not duplicated. Services under the National Psychosocial Support Measure can be delivered in a group or individual format in a variety of settings, such as community or centre-based. Support will generally be offered on a short-term basis and is intended to be less intensive than those services provided under the NDIS. Should the person require ongoing support, the NDIS should be explored as a more appropriate service response. The focus of support will be around building a person's capacity in key areas such as social connections, maintaining housing, maintaining physical health, and so on. Support can be delivered by a range of workers such as a peer support worker, and the PHN would encourage this. As you can see from the out of scope list, the National Psychosocial Support Measure isn't a clinical service, as it's expected that this target cohort will be receiving clinical care under primary health care. The National Psychosocial Support Measure should not be considered in place of the NDIS, as the typical clients who should access support under this measure will generally be those that are new to the system or those that have previously never received support for their psychosocial needs. So, what is continuity of supports? In the 2018-19 federal budget, it was announced that Commonwealth mental health clients from Partners in Recovery, personal helpers and mentors and day-to-day living who have applied to the NDIA but are deemed ineligible would continue to receive services. PHNs were identified to commission these services, which will commence from 1 July 2019, when transition to the NDIS is expected to be fully rolled out. At this stage, given that we don't know the number of people that will require support under this funding stream, the quantum of funding has not been confirmed. This cohort will be better understood once we are closer to full NDIS rollout. Whilst the department is still to provide information regarding the implementation of continuity of supports, we can assume that these services will be similar to existing Commonwealth mental health programs. What's in and out of scope for continuity of supports is not too dissimilar from NPS, and the PHN is considering this funding arrangement as part of the National Psychosocial Support Measure. On the 6th of February 2017, the Commonwealth Government announced Central Queensland, Wide Bay and Sunshine Coast PHN as a national suicide prevention trial site, specifically in the areas of the North Burnett, Maryborough and Gympie. The main aim of the National Suicide Prevention Trial is to gather evidence in relation to suicide prevention activities in regional areas of Australia and to further understand what strategies are most effective in preventing suicide at a local level and with at-risk populations. Services for people who have attempted suicide or who are identified at high risk of attempting suicide will be provided in all trial sites. In addition, there are target groups within each trial site, and these target groups will be identified in local community action plans. As previously mentioned, at this stage, the PHN will be using this tender process to gather the level of interest and the capability in delivering psychosocial services in one or more of the trial site areas. This table helps to demonstrate the target population for the National Psychosocial Support Measure and continuity of supports. You can see that the top percentage are for those who will be eligible to receive psychosocial supports under the NDIS. The next cohort will most likely be those who will be receiving psychosocial services through the Queensland Health Commission services or those who are eligible for continuity of supports. The third cohort will be the target population for the National Psychosocial Support Measure, and as previously outlined, it will generally be those who are new to the system or have their clinical needs met through primary care but still require a response to their psychosocial needs. This table sums up those who we are aiming to target through the three funding streams. So whilst the guidance for the National Psychosocial Support Measure does not specify an age restriction, the PHN is generally targeting the funding for those aged between 18 to 65 based on identified service gaps for people of these age groups. We know that this target group will be experiencing severe mental illness and needs assistance with a range of life skills to ensure that their recovery journey is optimised. The psychosocial services that will be funded through Queensland Health will be targeting those people who are receiving clinical support from local hospital and health service teams such as Queensland Health mental health case managers. the National Psychosocial Support Measure will complement services for people who do not meet that criteria and, as previously outlined, are new to the system or are having their clinical needs met through primary health care. We know that continuity of supports funding is for those existing clients of Commonwealth-funded mental health programs who meet NDIS access requirements but are deemed ineligible. We've also previously outlined that each trial site area has an identified target population to focus on as part of the National Suicide Prevention Trial. The PHN has made a decision that in order to submit a bid, providers must already have a footprint within the PHN region and must already be providing mental health services. This does not have to be across the whole PHN region. You may be delivering services only in a particular area. The PHN has decided to stipulate that in order to bid, providers must have existing mental health funding arrangements with one or more of the following funding bodies: the Department of Health, Queensland Health, Department of Social Services, or be a PHN commissioned mental health service. The PHN recognises that this funding will be an add-on to existing funding, as the funding available through this tender is insufficient to establish a new service provider. While it's not an exclusion, the PHN highly desires service providers who are NDIS registered and operating under the scheme. The PHN has listened to the needs of consumers and carers in relation to service access. Their feedback has informed us that a central point of entry was beneficial as it makes it easier when trying to navigate the system. Consumers and carers also outlined that whilst a central entry point is necessary, this should not be the only point of access. In late 2017, the PHN commissioned Ardius Health to provide a central intake function for the mental health stepped care program. This central intake function will be expanded to also include the National Psychosocial Support Measure and the National Suicide Prevention Trial. Those eligible for continuity of supports will already be known to providers, so there is no need to expand the service to include this cohort. To provide multiple points of access, consumers, carers and referrers can also contact those local service providers who receive funding under the 3 funding streams. The local service provider will therefore be required to follow the existing intake protocol through Ardius Health after contact with the consumer. The benefit of utilising an existing central intake line is that it is already recognised in the community and it integrates both clinical and non-clinical services and streamlines reporting, trends and outcomes. The PHN will establish a panel of preferred providers to deliver services under the National Psychosocial Support Measure, Continuity of Supports and the National Suicide Prevention Trial. Just to clarify, this is a supplier panel and is not to be confused with an evaluation panel. The panel will be formed by those successful bidders as determined by the evaluation process. Not all bidders will be on the panel. These panellists will be required to sign a Master Services Agreement with the PHN. The offers received through this tender will remain current in accordance with the MSA and be for the duration of the term of the MSA, which we anticipate will be until 30 June 2021. After the panel is established, the PHN will issue work orders to all or some of the panel. For further detail, refer to the draft MSA that can be downloaded through TenderLink once the tender is open. The PHN Commission services will need to be implemented in a flexible way to complement state and territory psychosocial support services. As previously mentioned, the PHN will be consulting with Queensland Health on their commissioning approach, and the PHN will be looking for service models that complement this. As we've previously outlined, the PHN has grouped 3 available funding streams under the one tender, as their primary focus is to deliver psychosocial services. So what does it mean to be a panellist and what are the benefits? For starters, it means that panellists may potentially receive funding under 3 different streams: So if a panellist doesn't receive a work order under one stream, they may receive a work order under another stream during the term. Work orders will be equivalent to a contract schedule. While they may vary according to the factors listed above, we anticipate that a typical work order will be for an extended duration with sufficient funding for around 12 to 24 months of service. It is important to note that not all panellists will necessarily receive work orders, and panellists may receive different funding at different times. The draft MSA contains further information. This chart provides a visual overview of what it means to be on the Psychosocial Provider panel. You can see that all compliant bids will go through the PHN evaluation process as the first step. The evaluation process will determine successful and unsuccessful bidders, and as you can see from the chart, bidders B and D have been unsuccessful, and bidders A, C, E and F have been successful. This means that bidders A, C, E and F now form the Psychosocial Provider panel, and they'll be invited to sign a master service agreement. The next step is for the PHN to issue work orders to all or some of the panel members. You can see from the flow chart that under the National Psychosocial Support Measure, only bidder A has been given a work order. For continuity of supports, however, both bidders A and E have been issued work orders under this funding stream. This is an overview of the tender process. The PHN uses an online tendering portal called TenderLink. The details on how to register will be provided later in this briefing. Once bidders have registered and after the tender is open, they can download and read the bid documentation. This includes information on what is required in the bid, the conditions of participation and other supporting documentation. TenderLink has a forum that bidders will need to use if they wish to ask clarifying questions once the tender is open. After bidders have submitted their offers or bids, the PHN will evaluate the bids in accordance with the evaluation criteria and the conditions of participation. After the PHN has undertaken its due diligence and is satisfied with the outcome, the PHN will invite successful bidders to sign a Master Services Agreement, MSA. Bidders who have not been successful in becoming a panellist will also be notified. After the panel is established, the PHN will issue work orders as described in previous slides. As previously mentioned, the PHN uses an online tendering portal called TenderLink. To access this portal, bidders need to be registered, and this can be done by typing the above link into your web browser or by navigating through the PHN's website. Click on Opportunities, Commissioning and Tenders. Just a quick tip, please do not use Internet Explorer. We recommend Firefox to ensure all functions are enabled. Once you've completed the registration process and set up your password, the system will take you back to the home page where you can log into the portal and access tender information and submit bids. Once you are logged into the home page, click on the All Current Tenders tab. This will take you to a list of current open tenders. Once you click on the tender notice link you wish to submit a response for, see the circled example, it will take you to the details page for that tender notice. The Details for Notice section gives an overview of the tender and details of the opening and closing dates. Click on the evaluation portal link to enter the portal and submit a bid response. The link will take you to the next section where you can download tender documents, create a new response, or view requirements of the tender. Check the acknowledgement box, then download the tender documents. Click on Create a New Response to start your tender process. Responses can be saved as you go. You can enter and exit the response as many times as you wish. Responses can be edited at any time prior to completion and submission. The Support and Help tabs have a number of supporting sections and FAQs to help with the registration and tender process. Technical support such as difficulty logging on can be obtained via the Tenderlink support email. Contact details are on the portal. Clarification questions such as program delivery or tender requirements must be submitted via the Tenderlink forum once the tender is open. All questions and answers from the industry briefings across our PHN region will be available on Tenderlink and on the PHN website. Please note that answers will not be visible through Tenderlink until the tender is open, so we suggest that you check the PHN website in the meantime. We'll also email those who attended today when the questions and answers are available, but we anticipate that this will be around Monday the 10th of September. If there are any questions that you think of after today, please email the address provided on the slide, Candice Finch, only until the tender opens. Any further inquiries while the tender is open will also be answered via Tenderlink to ensure that providers have the same information available to them at the same time. Please do not contact PHN staff directly. Requests for information and/or clarification will only be responded to if asked via the forum in Tenderlink, as this will ensure that the process is fair and transparent. Questions asked via any other method will not receive a response. Bidders may request additional information or clarification at any time before the closing date, which will be 1 week prior to the tender closing date. Please note that the responses will be posted on the Tenderlink forum and will be able to be viewed by all bidders. This is now the opportunity for you to ask questions that we will be taking on notice. Please remember that questions and answers will be compiled from our 3 industry briefings and will be available via the PHN website. As previously mentioned, we will email those that attended today when the responses are available. We thank you all for coming along to our session today, and we hope that you're excited by this opportunity. We look forward to receiving your bids.